It's 104.8 Channel 4. This is Faris, and today I'm speaking to Dr. Maryam ElTahir, who is a physiotherapist with NMC Royal Hospital. Thank you so much, Dr. Maryam, for talking to us today.
It's my pleasure, Mr. Faris.
So we are talking all about breast cancer awareness because, of course, October is Breast Cancer Awareness Month. So can you tell me how physiotherapy can help women who are going through some of the symptoms?
All right, so the first rule of physiotherapy with these patients, they first are very depressed and tired and exhausted, either before the treatment or after the treatment began. Anyhow, our role in physiotherapy is limited, but it depends on the patient condition. Before the operation, we prepare the patient about our plan and rules. Most of them, they do a surgery of removing some of the lymph nodes under the armpit, or they remove the breast. So the role of physiotherapy is only maintaining the hand and the arm function and decreasing the swelling that will come after the operation. And this swelling is called lymphedema.
Okay,
So,
and what sort of physiotherapy would you do for that specific thing, which was to reduce the swelling post-pop?
All right. The type of treatment that we are doing is all manual treatment. We have some specific bandages that we tie the arm with, so the reduction for the swelling will start more fast. And then we do something like a lymphatic massage. It's a technique. We open the closed lymph nodes and then we take the swelling from the hand up to the heart. It needs a physiotherapist to do this because they are specialized in this. And then we keep the bandages, and then we have a compression machine. We keep the hand inside. It keeps squeezing the hand, something like pumping the blood back to the heart, so the swelling will slowly start to reduce.
And are there physiotherapy exercises that patients will have to do on their own at home after the procedure?
All right. So they cannot do anything before they consult us regarding the exercises, because it depends on how big is the scar is and how big the operation was. So regarding the exercises, most of the cases, we start from day one to restore the hand function, because the scar will give them some pain and then they feel some burning sensation. So we will motivate them to at least 5 or 10% of the hand movement. They have to start doing it. Lift the hand up to the side and backwards. We teach them some shoulder and neck exercises because that will be a bit free and tight. We advise them to start walking 5 minutes in a safe place to avoid any contaminated areas. And they come to our department for maintaining of their health condition, because the physical activity and the mental health is our number one goal for breast cancer patients.
That's really interesting. Well, we're going to come back with Dr. Maryam ElTahir from NMC Royal Hospital Sharjah in just a bit to ask her some more questions about physiotherapy and the role it plays when it comes to breast. Right here on 104.8 Channel 4, and I'm with Dr. Maryam ElTahir, who's been answering all of our questions when it comes to physiotherapy and its role when it comes to the recovery from breast cancer. Very interesting. And I'm sure it's different for every patient and every procedure, but what sort of recovery period would you expect? How long do you have to do physiotherapy for as a general rule?
During the treatment, most of the patients, their treatment period is for 6 to 8 months, if it was radiation therapy or chemotherapy. So in case it was merged of both, the physiotherapy will be the whole time during that treatment. Plus, after they finish their radiation, chemotherapy or post-op cases, they keep maintaining the physiotherapy at least once per week for a whole 6 months.
And aside from physiotherapy, in order to deal with the recovery, what else should patients know about scar management?
All right, that's a very interesting topic. So for the scar, after the doctor is operating and he stitched the area or place, if it was underarm or on the neck or on the breast, most of the patients, they complain of feeling the scar is tight and it's pulling their hand inside. For me as a physio, and for all of us, we have a technique called scar mobilization, which is a way we keep moving the scar in and out, up and down, so at least it will not have any adhesive, but it's not sticking to the skin. The scar should be loose and it should be soft. So in a period of 3 to 4 weeks, it should be fully open, and the movement of the hand, the shoulders and the neck should be full. It should not bother the movement.
And as far as you know, is the recovery period a painful one, or is it like a numbness?
In case the patient did a mastectomy, a removing of the breast, the recovery period will be longer. It will take somehow 3 to 4 months for them to feel that they are pain-free. So in this period of time, they have to keep mobilizing themselves. They have to engage themselves to so many activities, including upper limb body strength, start lifting mild weights, doing some resistance exercises, join some fitness classes, do aerobics, breathing exercises, that all to maintain the blood circulation and give them some boost to their rehab program. After this period, they should feel a bit less tensive and the pain should be, I can tell you, 2 out of 10 in this period of time, so they can engage themselves back to their normal daily activities.
Well, that's been very eye-opening. Thank you so much, Dr. Maryam ElTahir, physiotherapist at NMC Royal Hospital.
You're my big pleasure. Thank you so much, Mr. Faris.
Thank you so much.